Good morning, everyone. Thank you for joining us today for this insightful webinar on Speaking Your Way in the Classroom, Techniques for Long-Lasting Voice Health. I am Timothy Howe, and I will be your host for today's event. Before we begin, let's take a moment to go over some important guidelines to ensure a smooth experience for all. First, please ensure your microphones are muted during the presentation to avoid any background noise. Second, if you have any questions, feel free to type them in the chat box. We will address them during the open forum session. In the meantime, feel free to type the title of your favorite song in the chat to let us know you're joined and ready. Third, we also encourage you to turn on your cameras to stay engaged and participate in the activities and discussions. Fourth, before the end of the session, we will be sending the link of the webinar evaluation via chat box. Please make sure to answer it to receive your e-certificate. Lastly, please be informed that this session is being recorded for documentation purposes. Thank you for your cooperation. With that being said, let's begin the program. As educators, our voice is one of our most valuable tools. It is essential not only for delivering lessons, but also engaging and inspiring our students. However, the constant use of our voice can lead to strain, fatigue, and even long-term vocal issues if not properly managed. This is why we have organized today's session to help us learn effective techniques to maintain and enhance our voice health. By the end of this session, we are expected to first understand the importance of vocal health and learn practical techniques to prevent strain and injury, ensuring that our voice remains strong and clear throughout our teaching career. Second, acquire knowledge about proper voice warm-up exercises and daily habits that promote vocal endurance and resilience. And lastly, explore strategies for recognizing and addressing early signs of vocal fatigue, enabling us to take proactive steps to maintain long-lasting voice health. Ladies and gentlemen, it is my pleasure to introduce our esteemed speaker for today. Jimby de la Cruz is a highly accomplished singer, theater artist, teacher, and entrepreneur. She earned a degree in music education from the University of Santo Tomas and a degree in musical theater from LaSalle College of Arts in Singapore. Currently, she is a professor at Assumption College and runs a successful private practice that offers vocal lessons and musical theater workshops to enthusiasts and professionals of all ages. As the founder of the Prod G Collective and a member of the Theater Artists Guild and National Association for Teachers of Singing, Jimby is highly regarded in the industry. She is also the voice coordinator for MTNA Philippines NCR, which speaks to her passion for nurturing and developing emerging talent. Jimby's theater credits include Shiro and the Cherry Blossom, Working, Singapore, Cathy the Musical, Rock of Ages, and 3 Stars and the Sun. In addition, she has worked as a voice coach for several productions, including Rock of Ages, 3 Stars and a Sun, Care Divas, Walang Aray, and Tabing Ilog. You can also follow her on social media at Jimby de la Cruz to keep up with her latest performances, coaching, and workshops. Without further ado, let's welcome Miss Jimby de la Cruz.
Hi, good morning, everybody. I hope you can hear me clearly. Please let me know if you cannot, and I will adjust my settings accordingly. There, I see thumbs up from everybody. So, hello, good morning. Here we go. Let me just up my presentation for you. If you do have any questions, you can type it on the chat box, or we will have like a 30-minute discussion later on, and you can ask your questions during that time. Okay, please let me know if you can see my slide. I hope you do. And I hope it's clear as well. There, we're skipping a little bit because we have gone through our housekeeping for today's webinar. So welcome everybody for today's voice work workshop. As teachers, our voices are really one of our most essential tool. So today, I would like to help you explore how understanding your vocal anatomy, assessing your vocal habits, and practicing effective vocal exercises can help us maintain vocal health and improve our teaching experience in the classroom. So first and foremost, I would like to ask everyone to log in first to Mentimeter. You can use that QR code to log in, or you can go to mentimeter.com.
You can see Jen's window. Enter full screen mode.
Oh, okay. Hold on. Let me do that. There. Is that better?
Yes po.
All right. Thank you. Okay. Can you guys still see it? Oh, it's paused. Hold on. I have to give me a second. Overused. I can clearly see that. Yes, just type in how you're feeling with your voices for. So we have only one. Is everybody agreeing that it's just overused? Anybody else? You can log into mentimeter.com and type the code 7109-7353. I will wait for your responses because we want to know what is the most common voice issue that you face as a teacher. Let me also adjust my volume. Hold on, give me a second.
Is this better? There you go. None. Strained for large classes. Modulation, throat irritation, vocal fatigue. Guess. Okay, we all go through that information. Teacher, what are we doing with this inflammation? Sing, voice, none. Okay, we have 13 responses. Do we have any more? There we go. We do have strained voices going on. Okay. As that goes on, we'll address all those Inflammation, teacher, I feel so bad for your inflammation. Well, hopefully on this talk, we'll find out how we're going to fix that. So I will first talk about the vocal anatomy. It's very, very important that we talk about the vocal anatomy so that we have a little bit of a background about our instrument. So first off, we have the breath. So we all know that the breath is the foundation of the voice. And I'm sure everybody who has done singing will be talking about the diaphragm. The diaphragm works both ways, and I mean both ways by when you sing and you speak, we need to engage the diaphragm. So we always forget how to engage the diaphragm because we don't know where it is, or because we don't know what it does. Generally, a diaphragm is a very thin film of muscle that separates our lungs from our large intestine or the stomach. So what it just does is to actually control the breath down, up, down, and then up. If we are not sure where diaphragm is, I want everybody to put your hands to a fist, and we are going to blow air through that tiny hole that we make with our. So everybody, if you can do this. You're going to feel your diaphragm go up. So one more time, to a fist and blow air. This also engages your diaphragm to breathe down and then up. So it is the primary source, well, the primary source of our voice production is literally the breath. So the function of the diaphragm is to just control the air upon exhalation. And with diaphragmatic breathing, it really helps support our voice as teachers when we speak. So, like what you said a while ago, parang hindi gumagasgas yung sound that we are doing or we are making in the classroom. So with engaging our diaphragm, if you are not sure if you're engaging your diaphragm, another technique is to make sure that you pull your belly button in. So you want to sit up straight and you want to pull your belly button in. This also engages your diaphragm and engages your support for speaking. I'm admitting people. Hold on. So here, the function in breathing, during inhalation, the diaphragm contracts and flattens, like I said, creating negative pressure. And then when you exhale, it moves up again. Okay, now I'm going to talk about the vocal tract. So we, as teachers, it's important that we are familiar with our vocal tract and where we are speaking. As you can see, the most important things that we are using when we're speaking is the lips, the teeth, the tongue. So our mouth or our tract area. We also have the nasal cavity, hard palate, soft palate. That's where we resonate the sound. So we can talk here in front, or we can slowly move the sound towards the back of our throat to give us a little bit more modulation when we speak. And the uvula, pharynx, epiglottis is where the voice box happens. And this is where a lot of the resonating of the voice happens. So it goes up here, bounce the sound over on this resonators, and then the articulators are right over here for us to, when we say our words or enunciate. Okay. Teachers, if you do have questions on certain topics, you can start like just typing on our chat box, and then we'll address these questions later on. So it's very important to have articulatory adjustments within the vocal tract. This contributes to intelligibility, vocal expression when we speak. Surprisingly, a monotonous sound actually causes more trauma to our vocal folds rather than speaking with vocal expression. So this is our larynx and our voice box. So this houses our vocal folds and control our airflow. So those who have not my throat problem, but if right now your throat is having a little bit of swelling, or you feel itchy in your throat, everybody, I would like to encourage you to actually do a laryngeal massage. I love doing this because it helps our vocal folds. So the first thing that I want everybody to try out, you do not need to open your microphones, is to actually say ha, 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 ha. Just feel the sound, feel, I know it's morning, so everybody's voice might be a little bit rusty or raspy or still very sleepy. I just want you to hear the difference in sound. So first, I would like you to get your hands and do just a slight massage from the mandible down here, down the larynx. So we're going to do that 4 or 5 times from here and then down. Just very, very quickly. And then we're going to start massaging up. So down here, up. About 3 to 4 times as well. And hopefully this also gets rid of, it's like a neck Botox. So you also want to massage the root of the tongue down here to release all that tension in the larynx. Then you want to find your voice box and just hold it to the right first. And swallow slowly. And also on the other side. And then try your voice again. Say ha, 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 ha. And you probably notice that your voice has cleared or that your larynx is a little bit more relaxed. The more relaxed the larynx is, the more resonance that you're going to get in your voice. So the gasgas or the paos is you get it from really tight larynx or swollen larynx, actually. So the larynx regulates our pitch, our volume, and the quality of the sound that we produce. A lot of the muscles in our larynx are used for singing and speaking. And if you do have singing training, the first thing that I would suggest is you start speaking how you sing, because this will take out all the speaking tensions that you have in the classroom. So how you're supposed to be singing is how you're supposed to be speaking as well. So this is our vocal folds. A lot of us, when we speak, tend to settle or use the thyroarytenoid muscle, which is the muscle that is responsible for speaking, and the lower register of our voices. There are 2 antagonistic muscles that are working in the vocal folds, and those are the cricothyroid muscle and the thyroarytenoid muscle. So the cricothyroid muscle is the muscle responsible for the higher register or the higher pitches of this. So what we want to work on is to be able to use these two muscles and coordinate them to actually come up with our teaching voice. So I'll talk about that a little bit more later on in our Q&A maybe. So the antagonistic muscles are the ones responsible for creating the sound. So you also want to exercise every day. One exercise that I like is the vocal fry. Some teachers don't like it, but me, generally, it's just relaxing the vocal folds on the thyroarytenoid area. So you want to go, so you go fry first and then sound. So once there is sound or intelligible sound that is being created, it means both your cricothyroid muscle and your thyroarytenoid muscle are now working together. If you're only using your thyroarytenoid muscle, you're going to have a fry. If you can hear raspiness in the sound, it means you're generally just a lot working on the thyroarytenoid muscle. So you want to raise that up so that you're using both muscles when you're speaking. Here, our resonators are the one amplifying and reshaping our sounds. So normally we would like to speak towards the nasal cavity without being really nasal. So it's not really here, but more near our teeth. And one way for you to direct the sound there is to actually hold the philtrum like this. Hello, good morning. How are you doing? So I do encourage everybody to try this practice. Hello, everybody. How are you doing? You're going to notice there's a certain change in the sound that you're creating. Holding your philtrum informs the body that you want to direct the sound towards that area of the face, and also use that area to resonate the sound that we're creating. So these are the common challenges of teachers in the classroom, and raise your hand if you agree. So of course, vocal fatigue happens because we continuously speak throughout the day. I am not sure what is the minimum number of classes that most of our teachers have, or the load that we have, without inadequate breaks. It can lead to vocal strain, fatigue, and it also is difficult for the teachers to actually recover from those fatigue. Hoarseness, it happens with prolonged vocal use, especially if we're trying to get the attention of 40 kids in our classroom. And hoarseness happens also when we do not engage our core muscle when we're speaking, or engage our both muscles of our voice when we're speaking. May I ask who amongst our teachers have experienced voice loss? Is there anybody who have experienced voice loss? Oh, apparently I cannot see everybody. Oh, there, yes, I can see hands up, teachers, if you have. Hopefully you have not. Voice. I will also address and recover our voices fast. Throat pain after periods of speaking. It's also because of the poor acoustics of our classroom. Let's factor in improper vocal techniques. Fine, that's what we're trying to get rid of right now. We are getting informed, and we are ready to take on vocal exercises before we start classes. So chronic coughing also happens, and there's a lot of factors with that. Are now whiteboards, the AC of the outside. A lot of this is factors from our classroom, is that we are in. Later on, I will have a self-evaluating assessment for the teachers, and this can help you pinpoint a lot of the things that affect voice in the classroom, and it's not just our voice use. So there may be teachers who have difficulty in projecting. Hopefully, we are going to be addressing that today in the vocal exercises that I'm going to everyone. And we can add a little bit of exercise in our Q&A section. So we often need to raise our voice, especially when children start to talk. There are 40 of them and there's only one of us, which leads to a lot of problem with vocal projection over time because we're always projecting our voices. Managing breath while speaking for extended periods can also be challenging, and it can also lead to inefficient vocal production. I hope our teachers are all exercising every day. This also helps our vocal health. If you are, good job. If you're not, we can like just walking can help increase our stamina when we're speaking. It engages our breath work and it increases the chance of us not having vocal problems. Voice cracking, this may be familiar to you teachers. When your voice is stressed and tired, and when you speak at higher pitches. Our vocal range also decreases as we go along with the year. There is reduction in range because we're trying to keep our voices in, and we are trying to regulate our voices. Hopefully we can manage it better this year, having more understanding on how we can have healthy voice production. So of course, all of that culminates to voice quality deterioration, a decline in clarity of tone, and it's now caused by fatigue and strain, and we cannot recover. So I do have an assessment that I will be sending out in the chat box. Do please take the time to answer them. I will be giving you about 10 to 15 minutes of time I will stop sharing first so I can share the link. Hold on. I should set this to everyone. Hold on. Oh, okay. Hold on. Everyone in meeting. There you go. Marami akong nakikita na mamaos lang. Okay, we're also gonna address that later on. Here we go. There is a self-evaluation PDF that is shared to the group. If you can take the time to actually, you don't need to answer them if you don't have any device with you, but take a look. It's fairly important that we understand what are all the other factors, because we always think that it's just the classroom that is giving us voice fatigue, that is giving us a hard time when we're speaking. Any allergies, diagnosis of allergies, asthma, bronchitis, or surprise, surprise, COVID. That is one of the factors that actually causes breathing problems. If you have had COVID, the lung damage is permanent. The lung damage that you have while having COVID will be permanent. But because the lung is a muscle that can be adjusted, your breathing can actually go back to 100%. even with the damaged cells in your lungs due to COVID. So it's just exercises and really informing your body to breathe better. I will also give you some exercises later on uh, to hopefully breathe better, to exercise breath work. So if you take antihistamines, analgesics, all of this can cause voice loss. If you suffer from acid reflux, do I have teachers who know that they have acid reflux? Acid reflux is not our best friend. They will burn your vocal folds. So even if you feel like your body is okay, having acid reflux will burn your vocal folds and cause voice loss. So sometimes we address technique, but we forget that there are underlying health issues that we have that can cause voice loss as well. So smoking also causes a lot of stress in our vocal cords. I will not judge as to anybody who is smoking, but yes, smoking can actually dehydrate the vocal folds, causing them to scratch each other more when you're speaking. If you're also frequently with people who smoke, you will share the same symptoms. So also water intake, take a look at that one. Maybe you're drinking just 1 to 3 glasses a day, or if you like to drink soda, or if you like to drink juices, cold drinks. Cold drinks doesn't necessarily causes voice loss. It doesn't. It's it may cause muscle spasm of the vocal folds or temporary paralysis for the vocal folds, but it should not cause voice loss. It's just similar to taking a cold shower after an exercise. Sometimes your muscle spasms because it's a very small muscle that we have for speaking, and it's taking 8 to 10 hours of a load, teach in the classroom, and we also tutor. You can see on the second page is voice use, and it tells you if you have had other voice training, not just singing, but also acting training or speech training. This also helps you because your muscles are more engaged, or you're more informed in how you're using your instrument. So please take a look at all the pages, teachers. I'll give you about 10 minutes. If you do have questions right now, you can send it in our chat box, and maybe I can address some of them. So this evaluation really just helps you to take a look at the load that you use your voice in, and hopefully how we can recover from it. No questions so far. Can you guys hear me better? Is this louder? Okay, thank you. So when you're, I would like to among you to stretch with your body according. One, nine, your body. One that I like to stretch every day. Want to and really try to have a good breath in. Inhale, expand your lungs, and then exhale everything out. Inhale again, and exhale. And then I move my body from side to side. I do this so that I can actually engage intercostal muscles. In breath, and then exhale. In breath, and then exhale. And for extra measures, sometimes I actually pat my intercostal muscles so that I know that they're engaged or they're informed that I will be using them for the whole day. If it's a long day of teaching, we tap the intercostal muscles. So a second breath exercise that I love doing to engage the back of and to encourage diaphragmatic breathing as well, well-rounded diaphragmatic breathing, is to breathe in and pretend that I'm drinking boba. So I'll hold my hands out, elbows out as well. Why? So that my back is open and ready to take in the breath. So big breath in, holding it in first, 2, 3, 4, 5, 6, and then exhaling everything out. Another in breath, boba straws. Holding the air in, maybe 8 counts, 10 counts. Keeping the ribs up, and then exhale. Everything out. Something as simple as that actually helps you warm up your body and gets your breath ready for a long day of teaching. So here are some vocal exercises. If you feel like I'm not a singer, I cannot vocalize and stuff like that, that's fine. These are vocal exercises that you can do anywhere, anytime. So lip bubbles are fairly important. Hold on, I cannot see my, okay. Can everybody see my screen? Yes, you can. Okay, so lip trills are very important because it helps the voice, the vocal folds to relax. So you want to put your lips together and then exhale to create a buzzing sound. So you can start with the bubbles first and then move to pitches. And you can do this anywhere. Normally right after class or before class, you can start doing lip trills. Humming also helps the voice. So try to hum and explore your vocal range through humming. This is a safe option for the voice to explore these resonance in your vocal tract and also our articulators. Mm, mm, mm. So all these humming scales and exercises helps you create resonance in your mouth. Sirens. So you're just mimicking the sound of a siren. And how this helps is it creates agility and flexibility in your vocal folds, moving from the lower register to the upper register. E, 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 e. And if it's just a short range, that's fine, as long as you're working on the in between. So with doing your sirens, you're also working with your thyroarytenoid muscle and your cricothyroid muscle, and you're making them work together. So it's like the cross exercise for the brain. So just working on that. If there's a break, try to smoothen that break. That actually will help your voice speak better, get less tension, and resonate better. Tongue twisters, seashells in a seashore, helps our articulators as we speak. Because I've also noticed a lot of people have a tendency to really speak just with the throat and the resonators right over here. Once we start articulating, the weight of that gets transferred to all the different muscle parts of our vocal tract, helping the folds just really resonate. So everything, when you're clearly articulating everything, when we're using our tongue, when we're using our mouth, the muscles are all working together versus only one muscle group takes a toll of speaking. So breath support, the one that we did a while ago when we move our body. If you are extremely tired after class, I do sitting down and taking just one full breath in, 8 counts, holding it on 8, and exhaling that on 8. So you go 2, 3, 4, 5, 6, 7, 8, and hold. And then exhale. Hold on 8, and then exhale on 8. 2, 3, 4, 5, 6, 7, 8. So here are some things, some tips that we can remember when we are having raspiness, talking too much in a day. Number 1, of course, is rest and recharge. If you can try to be very, very quiet at the end of your classes, it will help recover your voice faster. Coffee, tea, energy drinks, or sodas are all can cause dehydration in the vocal folds. So drink lots of water, at least 8 glasses of water. So what I do is just generally I try to finish a tumbler of water. This is my minimum water intake in a day to keep my voice hydrated, especially if it's a singing day or if it's a talking, like a full day of talking. Another way to deliver moisture or hydration in your vocal folds is using a humidifier in the room. So the number one culprit of air conditioned room is that it's drying your throat too much. So if you have a humidifier in the classroom or in your room at home when you're resting, it helps put moisture back in your vocal folds. Also, nebulizer can help with a 0.9% saline solution that you can buy at any Mercury drugstore. So just nebulizing with saline helps hydrate your vocal folds, especially during a very, very tiring day. Of course, we would like to modulate our speaking, less shouting in the classroom. Using microphones are highly encouraged because sometimes the students can be very rowdy in the classroom, and it's not just that. You're also competing with the air conditioning. You are also competing with the acoustics that was built into your classroom. You are also competing with the sound that is outside of your classroom. So I do highly encourage teachers using the microphone, but while using the microphone, also please engage in proper voice production. There's a tendency when we're using a microphone is that we actually try to speak like this and softer because you know that the microphone is going to be picking up the sound that you're making. So no, the microphone is there to amplify the sound that you're making, but it's still helpful to place our voices and to actually project our voices when we're talking to our students. It's just there to amplify. Posture, number one as well. I would like teachers to actually practice good posture. And with good posture, you get good support. And with good support, you get good voice production. Take vocal breaks. Take vocal breaks. Really ensure like a short period of silence. You can have student-led activities that can give you voice rest if really like so hard on your voice. Maybe a student-led activity is needed in this classroom to be able to sustain the day. Always speak in moderate volume. We don't need to be shouting all the time. And if we are going to be projecting our voices. Hey versus hey. So that's really throaty. But if we throw it with a modulation, we go, hey, it actually gets their attention the same way. I have stopped using my voice and getting attention. I have started clapping in classrooms to get their attention. So I don't use my voice and I don't shout. So let's limit smoking, caffeine, alcohol. They are all dehydrating your body and drying out your folds. So try to minimize as much as possible the consumption of those. Avoid clearing our throat. There's a tendency for us to go, this actually scratches your voice more. So what I can suggest and what I strongly encourage is to cough this way. It's like a really pressure of air just blowing out. Or do that and then take a sip of water. So, and then take a sip of water. Always monitor classroom acoustics, and this is something that you teachers, or me as well, are not conscious too much, is that there sometimes will be a spot in your classroom that when you speak, it bounces. And find these spots in the classroom because when you are on these spots, you don't need to speak so loud. It really resonates throughout the classroom. So find, like just monitor the acoustics in your classroom. Where am I speaking? Well, you're speaking, when you're speaking near an air conditioning, you know, you're also competing with air conditioning. If you're speaking near the door or the corridor, you're also competing with that area of the room. So find a good spot. Normally it's right in the middle and also in like middle of the classroom. There's a you know what I mean, teachers. There's a spot where it really resonates throughout the whole classroom. You can also use a lot of visual aids where you don't need to explain a lot of things to the students. Handouts is also encouraged, but I know some of our students do not read handouts. So there's that. We can also delegate speaking tasks. And this also encourages our students to be able to use their voice more efficiently and encourage them to speak better in front of our peers and teachers. Stress and tension can really affect the voice. So when we have heightened cortisol in our body has a tendency to shut down, and our facial muscles have a tendency to squeeze tight. And because the vocal folds is generally made of muscle, that's where fatigue comes in. And that's where the squeezing of the folds happen as well when we're speaking. Also, speak slowly. Speaking really fast and without breath control can strain your voice. I do not mean to speak really slow, but pace it, not as fast. Slowing down actually helps you maintain clarity and have vocal endurance if you're speaking for a whole length of the day. So find out where you resonate better. You can explore your voice in the chest sound, or do I speak better if I am placed up here where it's more on my upper register? Can I actually speak longer this way? Place my sound a little bit higher. Normally, elementary teachers encourage you to speak a little bit higher just because this really catches the attention of our students. They respond more to hearing high-pitched voices. And as we go and through teaching high school, they respond a lot more better to more resonant sound and something that is a little bit lower. This gives you authority over the students. This actually gives them like, grounding, especially for our middle school and high school students. They need more grounding and they respond a lot better with well-modulated sounds. Also, seek professional help. Do not be afraid to seek out speech language pathologists, voice teachers, or doctors. Your friendly neighborhood ENT is your friend to get you sorted, to make sure that your voice is in tip-top shape. You teachers, you are as good as singers because you use your voices every single day. So it's essential that you do have like a vocalise that you can do every day. This will strengthen your voice. Doesn't matter if you're on pitch or you're not on pitch. What matters really is you exercise that vocal muscle. So here we are. If you have any questions, I am now opening the floor, and hopefully I can get to answer most of your questions. Anybody for questions? Oh, you can mute, please. I don't mind if you unmute and ask. Do I have questions in the chat box? Repeating instructions. Oh, Sir Timothy, you're asking questions now. Okay, go. Oh, hold on. I cannot hear you. There's some. Okay, sorry. It's my fault. Hold on. Okay. Can somebody speak, please, so I can see if I can hear? Anybody? There. Yeah, I can hear you now. Okay, there you go. Sir Timothy, do you have a question? Anybody who has questions for me? So I have one here that says repeating instructions due to their young age. Okay, so what I normally do is I help the children listen first because they're so used to you repeating the instruction. So what I normally do to the children, especially little ones, is, hello, children, we're going to practice our listening skills first, listening. So if they see me do this, they have to engage their ears, which means I will say my instructions less. Or you can do, I'm listening, I'm listening. So making sure that they're ready for listening first is one of the key things that it will be tricky on the first few times. There will be a lot of repeating happening. But once they get understand that they have to listen first for the instruction before anything happens, the students will most likely to engage, especially when you give them cues. So, and then once they're used to listening, you can just go and you don't need to say anything anymore. So these things help the classroom and gives us signals that we don't need to use our voices too often. So you don't need to repeat you don't need to keep repeating, students, listen to me, children, listen to me. So you can just go, are you ready? Are you ready? Listening, listening. So they can get ready their ears to be able to listen, especially young children have a hard time because they have so much ideas. They're very imaginative. Trying to get their attention would be very, very hard. So doing all these small things first engages our student and gets them ready for listening before we give out instructions. So I hope that helps. Any other question?
Another question po from Neri. Says here, good AM po. Thanks for all your sharing. Is there a scientific level of oxygen that we need to meet, especially for senior citizens, so we will not be catching up your breath that may affect your speaking voice po?
Um, yes, Doc, there is a thing called spirometer that you can buy on any mercury drugs. I think they have it. So what it looks like is it's 3 balls that you have to suck in the breath and the balls would go up, and you want the balls to stay up for as long as you can. So this really helps our in breath. It's not really exhaling the breath, it's the in breath. So it helps us to expand our breath more, especially if you have had COVID. This is a very good way of expanding the quantity of breath that your lung, sorry, technically lung capacity. It expands your lung capacity, and with that, you get more breath in. Yes, and for seniors, I would strongly suggest daily stretching and exercising. It will greatly, and it doesn't need to be high impact at all. Stretching really, really helps the muscles release, and it also helps create more space for breath. So just stretching every day can help your body, or just do squats. This is something that I love doing because it's very low impact. You can start squatting and just do this and then breathe in. It helps expand your rib cage, and it also helps your breath capacity. And just staying there for a while can help and expand breath capacity in your back muscles or back lungs. Any other questions? I don't have questions.
Hello, thank you very much.
Hello po.
By way of sharing, just by way of sharing, you are really very, very young, and I love the way you give us your talk, which is very informative. There are 3 points that I would like also to share. Having been in the academy for 50 years, it pays really to drink lukewarm water.
Yes.
Never did I drink water coming from the refrigerator. Never. Never. Kaya po, this is my 50th year teaching. So, as a sexagenarian in the academe, opo, that's one. Never. Number two, I am not fond of chocolates. Kasi that really would affect my throat. Oo, anak. And being with Chiangkai for more than a decade, the oxygen level should not go beyond, I should not go below 92. That is our goal, 92. And when you inhale, very good yung sinabi mo kanina sa amin. When you inhale, hold your breath, and then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then exhale. Ha! Sisigaw talaga. And your hands, put it at the back, and it will help. Ako, kung kaya ko na magtingkayad or have something to hold on the back of the chair, so you will tiptoe, then inhale, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and so on. Ganun po. Salamat, anak. Ang ganda-ganda mo, ha? I love you. God bless.
Thank
Yan
you po,
po.
Dr. Yes, it's very important. I also, as a singer, I also drink lukewarm water, but that's just my preference. I just feel very cold when I drink cold water, and I feel like my voice spasms. So, but I do know a lot of other singers who drink cold water. But yes, thank you, Dr. for that. That really helps. Sir
Love
Timothy,
you.
anybody else have a question for me?
Another question.
How would I know if my voice comes from the diaphragm or the throat? Teach, you have to pull from the belly button. So when you pull your belly button in, hindi siya hindi siya yung stomach in na flat hindi siya ganyan. So you want to pull your belly from the belly button. You want to just pull it in and say ha ha ha. You're gonna hear it's very resonant. Versus ha ha ha. You're gonna feel it very throaty. You will automatically know that it's coming from the throat. All sounds will come from the throat. Yes, it will, because that's where the larynx is. That's where you're resonating. What we're trying to say a lot more is that you have to support from the breath or the belly button. Much less the diaphragmatic breathing and using the diaphragm is a term that has been used very loosely. Technically, when you're singing, you don't need the diaphragm. The diaphragm is just there to regulate the breath. So it's really engaging our core when we speak and when we sing. So pulling your belly button in to engage. So when you pull your belly button in, you're going to feel the muscles over here tighten. And then you know you're actually engaging your diaphragm or your breath for speaking. Any other question, teachers? Please abuse me so that we can answer a lot more other questions. Any other questions for teachers? I can actually see some of them are also my teachers. Hello po, ma'am. Kamusta po kayo?
Any questions po, each experience?
Yes, teachers, please. There's no any questions. I will take any questions. Okay. How will we know if our voice is warmed up enough? One, teach the speaking is very, what do you call it? Maluwag. So it's resonant. What I like to say is, you have to test it out. Your voice normally, if your voice is resonant, then you're fully warmed up. If your voice is ready, you're gonna hear it and you're ready to go like I can actually sustain this like for the whole day. So teachers, you might need to find like your teacher voice, something that you can sustain for the whole day. My journey has been because I lost my voice twice now, not because of bad technique, but because I was it was one with gastric reflux and allergies. And the other one was because I had really bad rhinitis and I did not manage my rhinitis. So mucus was dripping down my throat and my throat was swollen. And I still kept on using it because I had to keep on teaching, thus the voice loss. So what I did was I found a way and I did it through trial and error um, to find a neutral speaking or teaching voice. And I tested it out. And the one that can last for the whole day stayed. So it's like, oh, this is a very good resonance. I can speak in this resonance for the whole day. This is my teacher voice. And that has been my teacher voice for like the last 20 years. So, yes. When you're overdoing, you'll notice it as soon as you'll feel that your throat is itchy. You will feel a little bit of discomfort in the throat. Normally, that discomfort or itchiness can go away with water if you're just dehydrated. If um, if you're extremely tired, you're gonna hear a little bit of raspiness when you're talking. Pag namamalat na po tayo, napapaos na po tayo, nasa advanced stage na po tayo ng dehydration and inflammation. So just be careful of that one. These are your markers so that you know na, pag uminom mo ng tubig, medyo nag-clear siya, dehydrated lang siya konti, or pagod lang siya konti. And then normally, I choose to not speak. I do have an hour 3 times a week of vocal rest. So 3 times a week, I do have 1 hour in my day where I do not speak at all to anybody. If I need to tell you something, I will write it down. So vocal rest is fairly important as exercises that you do to strengthen your voice. I do not believe in absolute vocal rest because it will weaken your vocal muscles. So relative vocal rest is highly encouraged. Molds and rubber parts of tumble can, yes, of course it does. Yes, so please wash your water bottles cleanly. Molds can affect you anywhere. Sometimes ACs will have molds that will affect your nose. Our air filters in our classroom, make sure that we check it regularly. It will collect dust. And if it's not clean, dust will be spewed out of the air purifier. So, like I said, hindi lang po estudyante yung kalaban natin sa classroom, kalaban din po natin ng ating environment. So, if you're walking in the street of Manila, of course, kalaban din po natin ang fumes, usok, it will attach to your throat. There is an urban legend before that eating oily things can affect your throat. It's not the oily things that will affect your throat. If you eat fried food, the oil will stick to your vocal folds, which is not bad at all. But because it's sticky now, all the other elements that you're breathing in will also stick to the vocal folds. So it's slightly true that it can irritate the vocal folds. Like po yung sabi ni Dr. kanina, Dr. Melda, yung chocolate, sometimes chocolate can stick to your throat. So if you do like chocolate, eating chocolate, and it's also salty in the body, always hydrate. Always hydrate. Water is our friend. Does it affect our vocal health when we teach wearing a face mask? Not really, teacher. The flat ones does. I do have a face mask that is bigger in space, so it would help me resonate. So my face mask looks like this. Oh, you cannot see. I hope you can. Hold on, wait. So it's rounded there. If you can see, my face mask is rounded. It actually has more shape, and it doesn't really change so much the sound that I'm making because I do have a space to resonate my voice. So I am not pushing. If you do, teacher, want to wear a face mask, I do suggest get a microphone so that you're not pushing a voice, because there's a tendency to push the voice because feeling natin hindi tayo naririnig. So as long as your amplification works, then you're not pushing your voice too much. That's what we don't want, to push the voice. Does cold water really affect the quality of our voice? No, not really. It depends on the time you're drinking the cold water. If you have talked the whole day, I will suggest to avoid cold water. But if you're just talking for an hour and then you decide, oh, I'm having iced tea for lunch and I want it really cold, but you're not talking, you're not heavily maritasing with your friend, you should be fine. Yes. Any other questions, teachers?
Are there any other questions for Miss Jimby po?
Yes, teachers, you can unmute directly and just talk to the microphone, or you can type in your questions in the chat box if you're shy.
Yes, ma'am. Good morning, Miss Delic.
Morning po.
This is Mr. Soleto. Actually, I really appreciate your lesson for today, your training, because voice is very important in our delivering classroom instructions.
Yes, sure.
This is my questions. Is there any enhancing device or like technology that can be used to empower or maintain the quality of the voice?
Yes, sir. There are a lot of because there's a lot of speakers or voice users that are also visual people. So what they do, there are now apps online that will show you the use of your voice and how loud you're using your voice.
Mm-hmm.
So I can send out an app list where you can check them out if you want. I don't normally use them because for my profession so far, I don't feel the need to be using them. Normally the students kind of just use my ear and we work around really strengthening the vocal technique for singing and speaking. So for me, as of now, there's still no use for me, but there are apps out
Yes,
there
ma'am.
that actually would help teachers or voice users to be able to see the loudness or the softness of their voice. Something as simple as GarageBand or anything that has wavelength visually.
Okay.
Yes,
Yes, ma'am.
can inform you that, oh, I'm actually using my voice really loud, so I don't need to be pushing too much pala. Kasi malakas pala ako. Yeah. So this really also informs us. It's really like a learning tool for us as speakers to be able to say, oh, I'm gonna need to regulate my voice a little bit because I don't need to be this loud. Apparently, oh, the students can hear me. Yeah.
Yes, ma'am. Actually, thank you for that. The reason why I asked that, because most of the time we use the voice recorder. That's a one way to measure the quality of our voice.
Yes, po.
But there is another technology that you usually use before to my students, especially when they're practicing singing.
Yes.
Speech analyzer.
Yes.
Speech
These
analyzer
are,
is
yes, correct.
Like we try
These
to
are
practice.
tools to be
Yes.
able for them to see visually,
Ah,
because some
yes.
students are very visual. Yeah, but also I think because I'm a very auditory learner, that's
Mm-hmm.
why there was no that technology was not like I know of it. I know of the technology, but I don't use it in my practice. Yes. But yes, sir, definitely.
Yes,
Speech
ma'am.
analyzers and these apps right now that are coming out are really, really helpful for our students because they're able to see it and they see it in real time as well. That they're able to identify and see the vocal track that how they're using their voices.
Yes, ma'am. Thank you for those information. That's all for me. Thank
Thank
you.
you so much, sir.
All right. Are there any other questions for Miss Jimby Po? Questions?
Or sharing, teacher. I would love to hear like what you do in the classroom that actually works. Because there might be other teachers who are facing the same thing, and your experience might be able to help these other teachers.
So, ayun. Sir Villaverde is raising his hand. Sir
Yes,
V.
po, sir.
Hello.
Hi, sir. Good morning.
Hello. Good morning, Teach. Am I being heard?
Yes, very
All
clearly.
right. Thank you. Thank you. I have a question, Teach. Because I experienced this in my classes. Like some students have very soft voice, especially for female girls. I think it's their nature in the household not to speak much. So is there a specific technique for them to amplify their voice? Like, for example, for public speaking purposes, for presentation purposes, because I would always tell them to like raise the volume of your voice because I cannot like the classmates couldn't hear.
Here.
So is there a
Yeah.
specific technique for that? Thank you.
Thank you. So normally I think a lot of it is not just the household, but also the environment. Like, they start to speak really soft and I don't understand. So what I normally would do is to let them say ga, 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 like a GUH. So, ga, 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 ga. So this automatically, okay, so this will trick their body to create the sound that you want. What happens is the sound will open their voice track and their vocal folds. So they cannot do anything about it. The ga really would just open the throat. Ga, 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 ga. So once they start using ga, they will create more sound and more projected sound. And then as teachers, we can say, that's the sound that I want to hear. So we're going to try it again because they can go, ga, 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 ga. It's very hard. The vocal folds really would open on that specific set of consonants and vowels. The g is an onset sound, g, g, creating the closure of the vocal folds, g. And the sound really opens the vocal tract as well and the vocal folds too. So I would normally suggest, and Teach, let me know if this works for you. This is going to be so interesting because I use it for singing, but I think there's no way it's not going to work for speaking as well. So try to let them say ga, 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 and quickly say the words that they're trying to say in their presentation. But what you're going to expect is that it's going to be loud and whatever sound that like the position is good and then it's going to dwindle down. So we need to constantly remind them, okay, let's just go back to ga, 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 and then speak from the vowels. And then also, I find it helpful if the students get to engage their core muscles because they're shy, especially teenagers. they tend to, and of course, there's also vocal change happening during the ages of 10 to 13. Girls' voice would change also. It's very, very small, so it's often neglected, but there is vocal change happening with them as well. So this vocal change, as well as physical change in their body, really affects their self-esteem, the way they carry themselves, how they present themselves, and how they're being judged by their peers. So when we take that as a factor, we understand what they're going through. Asking for a louder sound without giving them the tools how to will not get the result that we want. So what I normally would do is to teach them how to engage their core muscles. Close your fist, just blow air. This automatically engage their core without them needing to think about it. And then from there, ga, 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 ga. Like, what is your speech pattern? And say, hi, my name is Jimmy. Ga, 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 ga. Ga, 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 ga. Hi, my is E. And then get the vowels. Just get the vowels in. And then get the consonants in. At the end of that exercise, you're going to notice that your students are actually engaging without them realizing that they're engaging. Because we are now talking about muscles that actually work for them. If that makes sense.
Thank you, Teach. Actually, I normally do that as well in my class. It's just that it's not ga that I would instruct them to pronounce. It's ha. This is my vowel H
Na-ah.
sound
Yeah,
of
yeah.
H.
The vowel
Yeah.
opens, right? But with the ga, the onset really helps because the ga sound, the ga is a like a plosive. My voice teacher is gonna get angry at me. It's a voice. It's a voice onset g g closure of the vocal tract. G.
Yeah.
G. So with the ha, see, because it's softer, ha.
Mhm.
You get the ah, but it's a softer sound. But with a g, it's really it's an plosive and it engages the g. So wala siyang choice kasi kailangan niya mag-loud. So we're positioning the voice for them to g, send the sound out. So that might help. Let me know, Teach, if that works for you.
Correct. Thank you,
Yeah.
Teach. It's actually I'm just interested to get a perspective from a singing from a voice teacher like who's engaged in singing, because like, in public speaking, that's normally what we do, especially like the belly button practice that you
Right. Yes.
explained. We
Because
do
it's the
that to really
same.
like
It's the same.
do vocal projection. Thank you.
Yes. Thank you so much, Teach. Anybody else?
All right. I think there are no more questions. Okay.
Last question, anybody? No more? Going once, going twice. Okay, so thank you so much, everybody, for being here today. And I hope I was able to give a little bit of information about the voice that can help you in our school year for this year. So thank you, everybody.
All right. Thank you so much, Miss Jimby, for enlightening us. We've gained valuable insights into the importance of vocal health and techniques in ensuring our voice remains robust and healthy throughout our teaching career. And before we conclude, we'd like to express our gratitude to Miss De La Cruz to Ms. De La Cruz for her valuable expertise, and to all of you for your active participation. As a token of our appreciation, we'd like to present her with a certificate of appreciation. The certificate reads, Chiang Kai-shek College awards this certificate of appreciation to Jimby Jill de la Cruz for sharing her knowledge, wisdom, and talents during the webinar titled Speaking Your Way in the Classroom, Techniques for Long-Lasting Voice Health, organized by the Office of Continuing Professional Education, given this 10th day of August 2024 via Zoom, signed by Mr. Judelio Yap, President. Okay. Again, the
Thank
whole
you.
CKS college community thanks you for gracing us with your time and knowledge. Let us show our appreciation to our resource speaker by showering her with heart or clap emojis. Thank you, thank you.
Thank you so much. Teachers, I'm also in the Chiang Kai-shek email, so if you do have any questions, you can just shoot me an email. I am there. So yes. Do you want to take a photo, everybody?
Yes, to commemorate this fruitful session, let's take a virtual group photo. Kindly turn on your cameras and wear your best smiles as we take a screenshot of all the pages I have here. Okay, let's try.
Si Mau, nasan ka?
All right, first page. Just keep smiling. I have 6 pages here. All right, 1, 2, 3. Next page. May I request for the other teachers to turn on your cameras? All right, 1, 2, 3. Next page. 1, 2, 3. Next page. 1, 2, 3. Next page. 1, 2, 3. And last page. 1, 2, 3. All right. So again, thanks. Again, much thanks to all the attendees. We couldn't have done this without your participation. Now, please do accomplish the evaluation form from which I will send via the chat facility so that we could send you the certificate of participation. Right, I'll be sending here. Yeah. Right. So we've reached the end of today's insightful webinar. Thank you all for attending today's webinar. We hope you found it valuable and informative. Right, thank you so much.
Thank you, everybody.
Right, thank you, everyone. I see you all on Monday.
Thanks.
Bye. Thank you,
Bye.
Ma'am Jindy. Bye.
Thank you, teachers.
Thanks.
Thank you. Thank you.